Hello, welcome to Revive and Rise. I'm your host, Melody Parrish, and I want to thank you for joining us today. I'm so excited. We have a special guest, Athena Hall. She is a pediatrician in Seattle, Washington, and the founder of Xena Health Network. So I want to thank you so much, Athena, for joining us today.
Yeah, thank you so much, Melody.
So, um, we've briefly met and kind of discussed your work. And it's fascinating that you have created this whole network of healthcare. Could you explain to us a little bit, about everything because you're into holistic medicine as well, right?
Yeah, so I went into healthcare because I was passionate about global health. And I did a global health fellowship right out of my residency training. From that experience, I saw how we were pushing our Western healthcare model on these communities without really understanding what they needed. And having this one size fits all healthcare model um, caused a lot of harm, downstream harm on these communities. And it wasn't really in line with their culture. And, we were bringing them into the hospital to give birth, and we had overcrowding. There were a lot of hospital acquired infections happening, and people really didn't trust the healthcare institutions. They thought the hospital was where they go to die, which oftentimes was the case because there was no running water. There were a lot of things happening that created that mistrust there. As a provider, we were expected to kind of teach the Rwandan trainees to shame shame the local people for using traditional healers, and we didn't really do any sort of collaboration or have any connection with the traditional healers, and so that furthered the distrust. And I felt that it was a huge missed opportunity where we could be collaborating with them and working with the community to really understand their culture and their beliefs and to support them in that way. Coming back to the US, I realized all of that is happening here as well. We're not understanding what people need, and we're pushing our healthcare model on our communities. And that we have seen, a lot of mistrust of our healthcare system as a result. There's not that partnership that's happening. And so I created this network to bring people together across sectors. So within healthcare and outside healthcare, anyone who's passionate about changing our healthcare system, bring us all together so that we can work on various projects that are in line with our mission to listen to our communities. So,
Oh, okay. Well, that's just fascinating to me that you're wanting to do this. Now, this is solely for professionals to get together and collaborate.
it's really for anyone. So, anybody who is an advocate for changing our healthcare system, they're welcome into the network. And it's a space to learn and to have discussions, as well as to be active in changing our healthcare system. A lot of us feel really powerless. Like, what can we do? We just throw up our hands. Our healthcare system just feels so enormous and complicated. And so this is a space where we can actually feel like there's something that we can do. We can support programs and projects out there that are doing really incredible work and feel
Mhm.
like we're part of the change.
Oh, I like that. I like that a lot. And I feel like yes, you hit it right on the head with you talking about how our healthcare doesn't it's like a one size fits all and you try and get it into other communities, especially marginalized communities, and that's just not the way it works. Life isn't just one fits all kind of thing.
Right.
What are some of the discrepancies or differences that you've learned through your journey?
Between different communities or
Ye Yeah.
yeah. Yeah, people that are living on the margins and are experiencing different types of discrimination, whether it be like racism or, um, you know, health disparities, challenges like people that are living in rural areas really have a lot of challenges in accessing care. Um, and so they have to travel, like here in Washington, they have to travel all the way to Seattle from hours away in order to see a specialist, or if their kid just needs, a night in the hospital for IV fluids, they have to travel so far to have that done. And yeah, I think it's really important to be listening to people that are experiencing those sort of disparities and understanding what it is, what their specific needs are, and to actually follow through in a kind of partnership relationship to show up and address those needs that they have.
Yeah, you're talking about a rural community. So I grew up in a very small town. We had one community hospital, and most of the time they could not treat uh, more of the complex things. So you'd have to go to another town. And then if you needed more care than that, you'd have to go to another place in the state. And we only had one trauma center. When I was growing up, we only had one trauma center in
Mhm.
maybe two, but that was it. Um, so I understand the rural complexities of that. And you're talking about like healthcare for people that are marginalized. I think the a lot of the thing is that we just don't have access. And if you do have access, you can't afford it. Have you noticed that in your work?
Yeah, and that's part of not having access is the challenges in affording healthcare. And there's really a lack of transparency in the cost. And so sometimes, you're like, well, I need this. This is, either a life-saving medication or something that I really need to have, or they say that I really need it. And then you get the bill and now you're in serious debt. So two-thirds of um, bankruptcy in the US is due to medical debt, which, is really astounding because we're meant to be helping people and supporting them to be healthy, but putting them into serious debt creates, further hardships for that person and deteriorates their health. So,
Right, right. And so, you know, November is our theme for November is mental health. Um, and like you say, we're talking about all these different stressors and it affects people's mental health, which ends up affecting their physical health. Could you talk a little more about what you've experienced in your work with that?
yeah, absolutely. Yeah, we know that chronic stress, has a big impact on people's health. It impacts your cardiovascular health and causes high blood pressure, can lead to um, heart disease, and as well as causing a lot of problems with your immune system, suppressing your immune system, and then you can have recurrent illnesses. There's so many impacts to chronic stress. So I think it's something that we don't pay enough attention to, even in a hospital setting. If somebody is hospitalized, we are waking them up throughout the night, getting vital signs. We have beeping monitors, bright lights. It's all centered on our workflow and what's efficient and what we want as providers and as a healthcare team instead of what's best for that patient, which getting good rest, not having, a stressful environment, those things may seem minor, but they are absolutely important in somebody's health and healing, especially during a serious illness.
Right, right. And it sounds like you're talking about like nutrition, rest, and for that, how important is that? And could you suggest anything to our listeners as far as their mental health and versus nutrition, rest, how important that is?
Sure, yeah. Mental health is, I think, the foundation of the rest of our health. If you have, you know, wherever you are in terms of your mental health, that's where you come from when you make decisions about if you're going to exercise, if you're going to eat well, who you spend time around, um, all of, what kind of things you're consuming in the media. So it's so important that we all have, a healthy mental, um, uh, you know, good mental health so that we can make good decisions for the rest of our health. And of course, nutrition and good rest, all of that is so important in just caring for our bodies so that um, we can live longer and have healthier immune systems and everything else. It all just kind of builds on each other. So
Oh, yes, I definitely agree. And also like exercise. How important is it, in your opinion, for us to move around? And can you suggest there's a lot of people that are like, I can't exercise. I'm so out of shape. Do you have anything that you could suggest for us to do?
yeah, so exercise is incredibly important. It's actually can be more effective than an antidepressant in terms of helping you to release serotonin and have more of an uplifted mood.
Mhm.
So I think any amount of exercise that you can do is great. For me, I would recommend whatever it is that you enjoy. Move towards what it is that you enjoy, whether that be swimming, dancing, being out in nature, being around dogs. Like for me, I love to take my dog on a walk, which is why I was late for this call today. So it's just so important to follow what feels good to you, and that's what you'll stick with.
That's true, because I feel like that's the important thing is sticking with it. I know I have
Mhm.
a lot of, trouble sticking with something. I can start something, but then it just falls apart after a couple weeks.
Mhm. Yeah, it's good to have, other people that can hold you accountable to it as well if you have some friends. And just, celebrating your progress, not being hard on yourself. Oftentimes we kind of fall off of what we're doing because we're beating ourselves up and it makes it not a fun process. So, whatever you can do to make it enjoyable and um, something that you feel good about is what's important.
That's true. Yeah, and that's the thing. We beat ourselves up so much about, you know, "Oh, I didn't go to the gym," or, "Oh, I didn't do this today, so I'm just gonna not bother tomorrow."
Hmm. Yeah.
You're right.
Yeah. And just having that commitment to yourself. Um, when you first decide to embark on a new journey with exercise or nutrition or whatever it is that you're doing, just to make, a really um, strong commitment to yourself and um, knowing that when those excuses come up, like, oh, I'm too tired today, or this is this and that, knowing that if you move through that on the other side, you're going to feel so much better than if you were to give in to those excuses.
Oh, yes, absolutely. So what you're saying is it's all like a mental struggle. You have to get over those things. You have to decide.
Yeah, yeah, just um, knowing that you're caring for yourself. And every time that I would take my dog on a walk when I'd come home from being at the hospital for over 12 hours, I was, reluctant at first. And every time I was just so glad that I did it. Because after spending all day in fluorescent lights and being in the hospital, it's like, feels so good to be outside and walking. And yeah, so
Yeah.
just moving through it.
Moving through, yeah, yeah. That's one way that I self-regulate too is to get outside and kind of just walk around and things. And we can use that, right, to help us.
Yeah, absolutely. Yeah, being outside and having that connection to nature is part of who we are. We are, you know, we are animals. We're part of nature, and so being out there is really restorative.
Yes, yes. So back to I don't mean to jump around, but back to what we were discussing before with access to healthcare. One thing that I've noticed is that in the rural communities, there may or may not be a hospital or health center or doctor's office, that's close by. But no matter what, there are very limited resources for mental health in those places. And even if there is one, it's a stigma. Like I'm not going to go there. I don't want
Mm,
to go there because I don't want people to think I'm crazy.
mm,
You know, have
mhm.
you noticed those kinds of things with your work?
Yeah. Yeah, I've noticed, especially, I think, in younger generations, there's more of an acceptance and less of a stigma around accessing mental health. But, there are a lot of online resources now. You can find so many mental health practitioners online.
Mhm.
So you don't even have to go into an office if that's one of the barriers for you. But for me personally, as well as what I've seen in other people, when I have invested in my mental health and have, invested monetarily and with my time and energy, it has just exponentially impacted my life in so many great ways. And so I think it's the best investment that you can possibly make for yourself.
Yeah, it's like I get it. It's like when you're talking about making the decisions and making the commitment. It's kind of like a form of self love. Would you say like
Yeah.
loving yourself?
Yeah, you're really investing in who you are and who you're becoming as a person and in your future. So it is a form of self love. Absolutely.
Yeah, nice. Yeah, I was just listening to you and I was like, oh, an aha moment, right?
Yeah. Great. Yeah.
So, what else have you learned through your like research about different areas and different communities, different people? I know when I went over to Ghana, it was that was the most refreshing trip I've ever had. Just
Mm,
see the people, to see their culture, and when they came to the clinic that we set up out there, everybody, no matter there were people with malaria that had these really serious diseases, but they dressed up in their best clothes and they came out to meet their friends and talk while they're waiting. So
mhm.
it was really interesting to see that kind of cultural experience. But could you talk about any cultural experiences that you've seen over here in the US like that or
Yeah.
cultural things?
Well, I would say abroad, I've also been to Ghana. Is a really beautiful place, beautiful culture. I've been to Kenya as well as Rwanda. And each time I've been to these areas, it's just, it feels like so refreshing because there's such a strong sense of community and care for each other and celebration for life, even though they are oftentimes living in, really extreme poverty and struggling to make it day to day. There's just a sense of celebration. You'll see people dancing and singing together, holding hands, really like caring for each other and showing up for each other. And that's honestly not something that I've seen in the US. because we have a much more individualistic culture and, a lot of isolation. And I think that is, where a lot of our poor health and challenges stem from is that culture and that society. And unfortunately, we're pushing our culture on these communities and they're becoming more and more westernized. And we're seeing more, you know, Western diseases cropping up there as well with hypertension and diabetes and cancers. So, but yeah, I think that there are little pockets of that in the US, and people are shifting out of this dynamic that no one is really happy in. We like to think that, we just want to do it all ourselves and have our nuclear family, and but as humans, we are naturally more community based. We need to lean on each other and care for each other and celebrate life. So, yeah,
Yeah. Oh, I love that. Because you're basically saying that we need support.
absolutely.
We
Yeah.
need support. And there is this mentality here that, oh, I don't need anybody. Oh, I can do this on my own, kind of thing. Um, so how would you think that we could combat that? Because even there are people that feel anxious when they are in uh, big crowds because they don't know how to handle it, or and a lot of people say, oh, I'm an introvert, has been just the general excuse for those kind of things. So how would you go about suggesting maybe something that we could do to counter that?
Yeah, I think just recognizing that it is a need for all humans to be social, and that a lot of those decisions to stay isolated are based on fear instead of that longing to be connected to others. So yeah, I would recommend like joining a class, finding something that you really are curious about, um, maybe something that you love to do as a kid. Might be like knitting, or it could be a dance class. Improv for me really brought me out of my shell. I used to be very shy. I would be really anxious around other people. I had pretty severe social anxiety. So doing improv classes really helped me to come out of my shell and connect and create community within that class and have those connections.
Oh yeah, yeah, I like that. I love improv comedy too. Uh,
Yeah, it's really fun.
yeah, it is. I think it's the best form of comedy because it's not rehearsed at all.
It's not, yeah, and you really feel like a kid when you're in it and when you're watching it, you're just like, "This is so fun." It just feels so, spontaneous, and it brings out all these different sides of you that you didn't know you had, so, yeah.
Yeah, yeah, and so it sounds like to me what you're saying is, like, to find people that have the similar interests to you, and
Mhm.
you can learn so much about yourself from
Yeah.
all of these different people.
Mhm. Yeah, and, we've seen the detrimental effects of isolation on our actual DNA, like, it breaks down your telomeres and can shorten your lifespan. So it really is important to have those connections with other people and to be interacting and just putting yourself out there, learning about who you are and learning about other people. That helps
Ye
you to get out of your bubble and see the world in a new way.
Yeah, and I feel like for those people that do have social anxiety, just sending friends a text is, is something, right?
Yeah, taking those little steps. absolutely can get you where you want to go.
Yeah. I
Mhm.
think so too. So when you're talking about healthcare, back to the healthcare, because I'm fascinated by your whole network that you have. Especially, I can't imagine how busy you guys are at the moment, because of the healthcare changes that we're going to be having soon. And just as a medical professional in general, how you're having to adapt and have these conversations. Uh, so what would you say to our listeners about the changes that are going to occur? Is there anything that you can tell us? Because I know there's a lot of people, there's a lot of questions, there's a lot of fear, stress. How can I do this? How can I get the care I need?
Yeah, it's definitely a uncertain time, and it's very, um, you know, when the big beautiful bill was passed, it was really disheartening to see how those gaps are going to be widening and disparities. Um, the people who can afford care um, are going to be more supported than everyone else, and the SNAP benefits um, potentially getting taken away. All of these things are safety nets that mass majority of people need, and the stories that are made about them are only created to justify what's happening. That people who need SNAP benefits are, um, you know, lazy and not working or whatever it is. These myths that are being spread. So I think just advocating, getting out there when you can, and speaking about your story and the people that so that people can understand what's actually going on. Uh, Some people are getting trapped in these bubbles and, you know, echo chambers, and listening to news that isn't really based in reality. And so, just speaking up as much as you can about your own reality and what you know to be true is, I think, how we're going to move through this.
Yeah, and I love that you say that because, there's so many people that are things that I'm hearing. Like you said, people just don't know what to do. And
Mhm.
they think, I'm just a person. What am I going to do? How am I going to matter? In this whole scheme of things. So I like that you say, share your story, tell us
Mhm.
things. And I think that's so important. And, you know, make groups like you've made the group, the network of people that are talking about these things. Now, could we make a network group like you've made? Would that be a possibility?
Yeah, I mean, if you have um, the passion and the time and capacity for it, absolutely. If there's a certain niche that you feel you have the background in and the passion around, then I think the future of healthcare and of our systems is that it's going to be a lot of interconnected networks instead of these silos living on their own in isolation. So if you have that passion, absolutely go after it. Otherwise, look for groups that you can be a part of and where you feel like you your voice is matters there, and you can learn and connect with other people.
Oh, yes. I like that. Um, and how would we go about finding these groups that you're talking about?
Yeah, so There are some groups on LinkedIn. I'm active on LinkedIn, and so you can find different groups there. There's, um, yeah, I think you just have to do some digging. Unfortunately, what I'm doing with Xena Health Network is to really amplify the programs and projects that are out there that people can be a part of, because they are so like it's so hard to find them, and it's hard for us to know what's going on and how to help.
Mhm.
So yeah, you might have to do some digging, but social media is a great place. If you're on Instagram, if you have an account where you're really trying to find people who are change makers, they're out there and they're posting a lot, and you can start following them, and then that will bring in more people like them, and you can find what you're passionate about.
Oh, yeah, that's good idea. Go on social media, find people that kind of align with you.
Yeah, yeah, exactly.
Yeah. So, and just talking to you, you know, it's the healthcare system we're in now. It's going to collapse, right?
Hmm.
Like you say, the single silo, single person. It it's got to collapse when you it costs a few cents to make an aspirin, yet in the hospital it costs like $6 or $8 for that same aspirin. Eventually, something's going to fall apart. And I like that you're saying the community nets of people, and so
Hmm.
and I think that's so important, right, for our mental health when we're going back to the mental health. Can you talk a little more about trauma and how some people may be a little hesitant to even go and get help, to seek a therapist, or even talk about what's happening to them or what happened to them. Could you talk a little bit more about how we could possibly overcome that?
Yeah, I think it's important to first talk to the people close to you so that you can find support within your network. And oftentimes they can point you in a direction, or you can. For me, I really learn a lot about myself when I'm talking to other people, and I'm like, oh, now I realize what it is that I need to do. It helps me to clarify things, and having that support from people around me, it just helps me to have that strength and clarity to move forward um, and to seek help. So yeah, I just encourage you to reach out to the people closest to you, and then to keep continuing to take those steps forward so that you can get the support that you need. Yeah, it will benefit you as well as everyone around you to care for yourself in that way.
Oh, that's great. That's great. Well, Athena, I want to thank you so much for joining me today and all of the expertise that you have shared with us.
Yeah, absolutely. This has been so wonderful. Thank you for inviting me.
And if someone wants to, do you have like a website or something that offers different things and education uh, tools for our listeners?
Well, I have a website for the network. So it's www.znahealthnetwork.com. You can also find me on LinkedIn at Athena Lauren, Lorin, Hall, Hall. And yeah, on the website, there's a place where you can join, and that will um, like automatically send you an email and get you um, regular emails for the newsletter for the network. And from there, you can just see what we're doing, listen, and decide if you want to join the network. at some point, and you can see what incredible projects are already happening in the world and what you want to be involved in.
Oh, that's great. That's great. Well, thank you for that. Yeah, you're more than welcome anytime to come back on and discuss more things and let us know, what the network's doing and the new projects and all of that stuff.
Yes, I will keep you posted.
Yeah.
Yeah,
So thank you for listening, guys. And just remember that you do not have to suffer alone.
you definitely don't.